Welcome, everyone, and thank you so much for joining this global consultation on the proposed World Health Assembly resolution on steatotic liver disease. I'm Professor Jeffrey Lazarus, sitting at the Barcelona Institute for Global Health, also a professor at the City University of New York Graduate School of Public Health and Health Policy, and I direct the global think tank on steatotic liver disease. Next. So we have 50 minutes today, as well as our second consultation on Thursday, to look at the global steatotic liver disease policy landscape, how we position SLD within the global non-communicable disease and metabolic health agenda. And we have 4 objectives for this consultation: to strengthen global support for the proposed resolution, to identify national policy champions so we can support this also at the Assembly, to foster dialogue and strengthen support for the resolution and SLD in general, and to recognize its global burden, both the human and economic burden and the links to major metabolic conditions. To this end, we have this series of global consultations, and we've also produced a position statement rather quickly, but already 55 organizations have signed on to this, including Liver, Public Health, and other NCD organizations from around the world, 23 patient and international organizations, 22 national level organizations, and you see some of them listed here, but really major organizations around the world, not just from the liver space, supporting this resolution on steatotic liver disease. Now, the Global Think Tank on Steatotic Liver Disease is a global organization that's trying to connect and innovate and foment transformation in the steatotic liver disease space. We have a flagship meeting in Barcelona every year that will be in May, just after the World Health Assembly. And we've organized this consultation with partners, as well as the global position statement and some other activities I'll mention just very briefly. Next slide. Okay. At the think tank, we're going to launch the Lancet Europe series on ending the chronic liver disease public health threat. That's 4 series papers, 4 commissioned comments looking at all aspects of chronic liver disease with an emphasis on steatotic liver disease. So stay tuned. We'll be sharing that at a media briefing all day on the 25th of May in Barcelona, and then it will go live on the 26th. Next. And as you can see here in the figures 1 and 2, one of the things we're going to be presenting in this series is that it's a very mixed landscape in terms of national action plans or strategies that address MASLD or MASH, even if we're referring to diabetes or obesity or nutrition strategies and action plans. Nary a mention of MASLD MASH, and in many clinical practice guidelines in adjacent fields of key comorbidities, MASLD and MASH are also not mentioned. So while CPGs need to have their own CPGs around MASLD and MASH, in other areas of, where we have action plans and strategies, we certainly think steatotic liver disease should be mentioned. And although you can't see the details here across Europe, it's often not the case that MASLD and MASH are mentioned. Next. With that, let me thank the International Diabetes Federation, the World Obesity Federation, and the Unite Parliamentarians Network for Global Health for being a part of organizing these consultations. We think it's incredibly important to see diabetes, obesity, liver, and parliamentarians of all stripes working together on this issue. Now, let me walk you briefly through the agenda. Our first speaker, Dr. Mohamed Hassany, will present an overview of the proposed landmark WHA resolution and what it will enable. Then we will have a country perspective from Spain from Dr. Pedro Gullón Tosio, who I'll introduce in a moment. stakeholder perspectives on why this matters from the World Obesity Federation, from the International Diabetes Federation, from the Unite Global Parliamentarians, and then we'll have a short discussion, all of us together, and with that, we'll wrap up just 10 minutes before the hour. So without further ado, let me introduce Dr. Mohamed Hassany, who I've had the pleasure to know many years and meet most recently at the World Health Assembly, the WHO Executive Board 2 months ago. You've been leading the development of this proposed resolution that looks at the integration of SLD into national NCD strategies, national guideline development, and financing and health system prioritization issues. So we look forward to you now walking us through what this resolution is all about. Thank you and welcome, Dr. Hassany.
Well, thank you very much, Professor Jeffrey, for organizing this important series of global consultations, which shed light on the proposed WHA resolution on steatotic liver disease. I wish also to commend the efforts of the partner International Diabetes Federation, World Obesity, and Unite for joining us in this important series and their leadership in this regard. And I wish to welcome all the attendees wherever they are. And thanks once again, Professor Jeffrey, for inviting me to brief you on that. And in my remarks, I will be very focused and very specific why we need this resolution and what it enables us to do. If you allow, yes. Thank you. Let me start with the gap, as this resolution addresses a disease that affects, based on some estimates, 1.7 billion, yet it's virtually invisible in our global NCD reporting. And against this backdrop, it would be the fastest growing driver of cirrhosis and liver cancer worldwide. And as noted in the preambular paras of the resolution, it suffers from, profound underdiagnosis and underrecognition, and we are seeing it rise sharply in children and in developing health systems. I would say that this is the missing piece of the NCD puzzle, and that's why the World Health Assembly must act. And if we see the global efforts on the level of the WHO, there is a complete ecosystem that is addressing the problem of viral hepatitis from prevention to cure. Yet, unfortunately, the steatotic liver disease, although the alarming figures, does not catch a similar or even suitable WHO response. As you know, that there is a clear figures, ultimate guidelines, and also strategies that would end in 2030 by ending the epidemic of the viral hepatitis with the morbidity and mortality. But unfortunately, when it comes to the steatotic liver disease, we did not even have any single piece of ecosystem that enable us to act in a similar way for steatotic liver disease. To close that gap, 18 member states led by Egypt have put forward this draft resolution. And this is not a mandate for a new expensive vertical program in view of the existing WHO budget cut. Instead of that, this resolution enables 3 concrete things. First, I would say the integration into the existing NCDs and the universal health coverage plans. The second important thing, the development of national guidelines, so primary care doctors know what to look for, and the specialized doctor know also how to act. And last but not least, it enables financing and prioritization by allowing us to build national investment cases. And there are, the tools we need to move ahead. Next slide, please. How do we do this without overburdening systems? The integration is one of the most important things. The operative para 1.2 is clear. We align the steatotic liver disease within the existing non-communicable disease strategies. Particularly, this means 2 things. First, we use the WHO best buys we already have on sugar reduction, the alcohol policy, the physical activity to prevent liver disease. And clinically, it means when we screen a patient for diabetes or heart disease, we simply add a liver health check. So no new clinics, no new silos, just a kind of a smarter, more holistic primary care. Next slide, please. But, integration requires 2 practical pillars. Definitely the guidelines and budgets. Firstly, the guidelines, we need a kind of a national protocols to prevent, to screen, and to manage as well. Primary care providers needs clear and very simple algorithms, and we also urgently need to end the stigma that fatty liver is benign. Second, this is vital for ministers of finance building the investment cases. So the operative para 1.6 in the resolution allows us to show the return on investment The screening and early intervention in primary care costs pennies, but unfortunately, later stages like cirrhosis and management of liver transplantation cost thousands and drain health budgets. This resolution gives us, the economic argument to prioritize prevention. Next slide, please. So what is the status now and what are the next steps that we need to speak about? The executive board has recommended it as a resolution, but now and in the coming May Assembly, the immediate action for member states is clear: to signal support and to co-sponsor that resolution. And I'm very glad to see in the meeting Dr. Pedro Gullón, the Director General of Public Health and Health Equity of the Ministry of Health of Spain, who is always a companion in the WHO battles. And we are very honored and proud that the Kingdom of Spain is a major sponsor of that resolution. And we are urging all the member states to do so. Once adopted at the WHA 79, which we expect, inshallah, the Director General is mandated under the OP2.2 to provide a technical support to help the member states to integrate the care for steatotic liver disease within the NCD ecosystem. And critically, the operative para 2.6 ensure the accountability through biennial reporting back to this assembly. This is not a one-time statement. It's a kind of a roadmap with a built-in follow-up mechanism. Next slide, please. So to conclude, and as it's crystal clear for all of us, the steatotic liver disease is a hepatic phase of the obesity and diabetes pandemic. We have the data, we have the science, we now have the political tool to address it. So I ask all of you to urge your countries to support the resolution and to ensure that when we talk about fighting NCDs, the liver is no longer the missing piece. Next slide. This is the end of my presentation. Thank you very much, Professor Jeffrey, and back to you.
Thank you so much, Dr. Hassany. I liked the closing slide. I mean, there's no reason not to support this resolution. I'm a little biased, but I mean, this is a disease that's affecting more than 1 in 3 adults. I mean, that's MASLD alone. And then if you add in MET ALD and ALD, it's so many more people. So it's about time. And just like the leadership you and your ministry showed with hepatitis C, now you're doing it again with steatotic liver disease, just like your minister told us a few years ago when they joined us at the World Health Assembly side event. They said Egypt is going to continue addressing the unmet needs of people living with liver disease, and you're doing it again. Thank you so much. I'd like to now welcome Dr. Pedro Gullón Tosio. Bienvenido. Thank you so much, Pedro. You're the Director General of Public Health and Health Equity at the Ministry of Health in Spain. We last saw you on World Obesity Day, but at a liver event. Thank you for joining us there in Madrid. Thank you for joining us now, and we look forward to your perspective on policy readiness and engagement.
Thank you so much, Professor Lazarus. Good morning, good afternoon, buenos días, buenas tardes, salam alaikum. It is a pleasure to be here in this brief presentation, and I would like to just say hi to Professor Hassany. As I said in the beginning, and as he said before, he's a companion for all the battles in the WHO for this resolution. So it's always to talk after him. And I would like just to use these 5 minutes just to talk briefly about why it is important to have resolutions like this in the real agenda of the member states, and then some things about that happened in Spain with steatotic liver disease, and how would you frame it, and how do we think the next steps will be for our country, just as an example of a country that is leading with putting this on the agenda. So going to the first point about the experience that we have with other resolutions and how it has an impact or not in the member states, I would say that it depends a lot. So as you know, the resolution doesn't make an obligation to other member states to take the steps that are needed, but it's a political excuse. And I mean that's not something that you cannot take it seriously, because it is quite important having this political support, because then and it happened to me when I have to write a law, a new strategy or whatever, and I like to get support, I always take like, yeah, but this was a resolution that our country supported last year, and the WHA supported as a priority for the next years. And it's something that we should take it seriously, as I said before. For example, sometimes an excuse for something that you are going through, something you are developing something as the work that we have been doing, for example, in rare diseases until last year, and then Egypt and Spain, we collaborated through a new rare resolutions for our resolutions of rare diseases, which put the things that we wanted on the agenda for Spain and for other countries. So that's something that's a position that sometimes you have, that you are doing something and you want to take steps further in that. But also, if you have nothing, at least you have the support of other countries, and you have a clear line of the things that it's the first thing to do. For example, as Professor Hassany has said, that this resolution might have on the beginning of, okay, let's connect this with the national non-communicable diseases strategies in the member states. That's okay. Let's get secure funding on these countries, and let's connect everything. And that's a big step. That's a big step for other countries that they just want to follow this kind of guide that sometimes the WHO resolutions are. So that's my experience with other resolutions, and that's why I think this is a resolution that it might be really helpful for other countries to move the direction and steps forward in chronic liver disease in general, steatotic liver disease in particular. How do we frame, and the second point that I wanted to talk about, how do we frame that in Spain, the steatotic liver disease, as a first step? Our steatotic liver disease and all the chronic liver disease programs are within the national non-communicable diseases strategy. As I think that this is kind of important, as Professor Hassany has said before, because sometimes the tools that we need to tackle steatotic liver disease are very cross-sectional with other non-communicable disease. Just thinking about, for example, now that we have obesity and diabetes over here, which is a pre-steatotic liver disease, but it connects a lot with the clinical guidelines that we need, the prevention programs that we need, the public health approach that we need for diabetes and obesity in terms of prevention. And that's the same things that happen with other diseases, all the health in all policies program, all the things that we need to talk about, the commercial determinants of health. That's the same strategies that we need, including general strategies also in the national healthcare system, such as screening or maybe clinical practices. However, I think we have two very big threats. I would say challenges in Spain in treating steatotic liver disease. The first one is that although we have a strategy on chronic diseases, and that we can have a clinic guidelines that we don't have right now, but we are planning to do in this year, clinical guidelines on steatotic liver disease, then you need to go to the reality of the medical doctors in their day-to-day life, and that's something that is so difficult, and that's an experience for all countries just to think about that. In the case of Spain, that we have a decentralized healthcare system, that is so important, because we have 17 regions and 2 autonomous cities that have responsibilities for healthcare system, and that's kind of important. How do you go back to the doctors and the reality of the doctors and the funding that is needed for that kind of programs, which is responsibility of the regions. But as a minister, we have to lead the way up to all the regions, and that's something that is a quite challenge for all strategies, but specifically for this one, as it has a lot of new implications. And then the second challenge that I think we have, and that might be common for other countries, is just thinking about only as a clinical approach and not a public health approach in everything. So the reality is that usually medical doctors are easily involved in clinical guidelines, and that's important, and that's a thing that we need to do. But sometimes when you want to do activities in the public health sector, not only in the healthcare system, the power that the healthcare sector has over public health, it's so important, because that's where is the money, most of the profession, etc. And as a public health professional, you need to go sometimes I have to talk with the alcohol industry, I have to talk to the sugar industry and everything, and try to tackle the commercial determinants of health in terms of prevention, which is something that is very, very difficult, and a challenge that is for Spain, but also for other countries, that at the same time that you put the clinical approach in the center, new clinical approaches on steatotic liver diseases, you cannot forget that you need to do a whole public health perspective on that. So just in summary, because I don't want to take more time, our experience with different resolutions is that it's always a political start point for some things, and it's so important. It's not something that is always only a paper. And the second thing is that in applying this in the countries, we need to take into account that it's difficult to go to the medical doctor's practice, but it's something that we need to work a lot on this. And then that the clinical practice and the public health perspective need to be aligned and and framing that and putting the resources into both things. And thank you very much for listening to me in these minutes.
Thank you so much, Dr. Gullón, and also for setting out some of the challenges we have, and maybe we'll come back to those in the discussion. Big challenges in how we address health issues when we're required to collaborate across sectors, whether it's ministries of finance, law, or elsewhere. I'm now going to turn to our stakeholder perspectives. And the first will be from the International Diabetes Federation. So I'd like to welcome Professor Peter Schwartz. He's the president of IDF and a very well-recognized expert in diabetes prevention and care. His work emphasizes translating evidence into policy and strengthening health systems to address diabetes and related metabolic conditions globally. He joined the UN General Assembly high-level meeting on steatotic liver disease, the side event we held last year in New York City. He's had an entire day that he presided over on liver health at the IDF conference, which is held every 2 years. And now he's going to give us the IDF perspective on steatotic liver disease and this resolution specifically. Welcome, Peter.
Thank you very much to Professor Lazarus and the IS global team for conveying this consultation and for bringing together such a strong and diverse group of stakeholders. I'm Peter Schwartz. I'm Professor for Prevention and Care of Diabetes at the University of Dresden, and I'm the president of the International Diabetes Federation. This dialogue comes at a critical moment. Just a week before the World Health Assembly, where member states will decide on the adoption of the resolution to steatotic liver disease. This is not just another agenda item, it's a political opportunity to address major gaps in the global response to non-communicable diseases. This resolution also builds on a broader political momentum. It follows the 2025 political declaration on NCDs and contributes towards the 2027 high-level meeting on universal health coverage. These are connected milestones, and this resolution is an important step in ensuring that metabolic health remains high on the global health agenda. Steatotic liver disease is deeply interconnected with the major health challenges that we are all working to address, including diabetes, obesity, cardiovascular disease, and many, many more. It affects millions of people worldwide, often silently and without diagnosis, and yet it has not received the level of political attention it deserves. This resolution is about recognizing that metabolic health must be addressed in an integrated, coherent way, not in silos. For the diabetes community, this is particularly urgent. A large proportion of people living with type 2 diabetes are also affected by liver disease, frequently without knowing it and often diagnosed too late. This has serious consequences for complications and health outcomes. This resolution gives us a real opportunity to bring liver health into the core of diabetes prevention, care, and policy, where it should have been all along. We know that WHO resolutions can make a big difference. Previous diabetes resolutions were instrumental in raising awareness, elevating diabetes on the political agenda, and mobilizing national action. They created momentum and accountability. The liver resolution can and should play a similar role in strengthening the broader metabolic health agenda. At the same time, we must be honest. Despite all the resolutions and commitment, progress on diabetes, metabolic health, and NCDs remains insufficient. The impact continues to rise, inequalities persist, and access to prevention, diagnosis, and care is still inadequate in many parts of the world. The issue today is not a lack of commitment. It is a lack of implementation and sustained political will. This is where civil society has a critical and implacable role. Change does not happen automatically. It happens because organizations, advocates, and communities push for it. Civil society is essential to drive political attention, to hold governments accountable, and to ensure that global commitments translate into real improvement in people's lives. This is my call to action today. Each of you has a role to play in this coming week. I encourage you to engage with your ministries of health and your national representative. Make the case for this resolution and advocate for your countries to vote in favor at the World Health Assembly. Your voice can directly influence national positions and contribute to a global progress. In closing, we do not need more evidence. We need action, action, action. This resolution is an opportunity to turn commitments into implementation, to strengthen the global response to metabolic health, and to improve the lives of millions of people living with diabetes and related conditions. We need to seize this opportunity and work together to ensure its adoption and its impact. Thank you very much.
Thank you so much, Peter. Thank you for the powerful call to action, but even more importantly, positioning IDF so in this space, in focusing on steatotic liver disease, but also reminding us of the role of associations. Not all associations are committed to taking this kind of political action, and we need to realize how beneficial it is for clinicians, including those just working on a daily basis in their clinics, to have overarching guidance and political will that their countries, the member states of the World Health Organization, have committed themselves to. So thank you to IDF. And let me turn now to Dr. Bruno Halpern. Bruno is a leading expert on obesity and metabolic health and the incoming president of the World Obesity Federation, where he's been affiliated for many years. His work focuses on clinical management of obesity, health systems approaches, and policy advocacy to address obesity as a chronic disease within integrated care models. We appreciate the collaboration with the World Obesity Federation. There was a joint statement read by the World Obesity Federation in partnership with the IS Global Public Health Liver Group at the WHO Executive Board in support of the resolution and recognizing the importance of SLD and obesity in WHO frameworks and action plans. And we're also excited about your upcoming conference, the ICO Congress, the International Congress on Obesity in Mexico City this July. Bruno, welcome.
Thanks, Professor Lazarus. It's a pleasure to be here with you, representing World Obesity Federation. And the World Obesity Federation for a long time believes that we need to change a little bit the focus on always the same chronic diseases, non-communicable chronic diseases. So the political declaration of the UN last year felt short to discuss obesity as a driver of many chronic diseases. Obesity, a lot of times is seen, we like to say it's everywhere and nowhere, because of course, it is the main driver of many other chronic diseases, but is not recognized as a disease by itself and only as a risk factor. So it's just like, oh, we have poor diet, we have poor lack of physical exercise and so on, but obesity is not named as it is. And my perception is that we need to focus and go together with the liver group, because the same happens with liver disease. Liver disease for a long time also has been seen as a risk factor, as something related to metabolic. It's a metabolic marker, but not as a disease itself by many people that work in the chronic disease group. And if we don't have a problem, if we don't see obesity or liver disease as a disease by themselves, or they are not a problem, we cannot have a solution for something that is not a problem by itself. And that's why I think that World Obesity Federation and the liver associations need to work together, because we live in the same scenario. Both diseases are, of course, absolutely interconnected. A lot of patients that have obesity will have liver disease, and vice versa. We suffer from the same stigma, let's say, like that, of not being seen as a problem, as, for example, type 2 diabetes, of hypertension, of chronic kidney disease. And we know the risks associated with liver disease, the cirrhosis risks, and so on, of course, the cardiometabolic risk as well. All the discussion on the cardiometabolic kidney disease that the American Heart Association is pushing for is forgetting a lot of different complications, the liver, other complications of obesity itself, and we need to be very careful so that obesity, liver disease is just seen as metabolic health in a broader sense, and is not seen as it needs to be seen. So I think that now we have a key opportunity to advance the integration agenda across conditions, and the World Health Assembly resolution will help that a lot. So that's why in the first moment when I knew that we are going to have this discussion, I was like in the same moment saying, no, we approve, we want to go forward in this path, we want to be together, so we can work for a better health in prevention and treatment. In obesity, it's very common that there's people that work in prevention that believe that we just need to work on prevention, and those who work on treatment think that prevention doesn't work. So we need to also approach an integrated approach of different diseases, and this integrated approach from prevention to treatment. So obesity must be explicitly recognized with this continuum, not lost in metabolic health framing. We have a shared drivers, the same patients, the need for coordinated responses. If we do as World Obesity Federation one idea of responses, and you do as a liver associations and diabetes that Peter was talking about as different, everyone pushing their own agenda without interconnection, of course, we are not going to any place. So I think that's my main point that I want to highlight. And I really, really believe that in the future we can work together, and we will be much more strong together, working on the same agenda. And World Obesity Federation really supports this new resolution. Thank you very much.
Thank you so much, Bruno. I mean, what I'm hearing is what we've long believed, that it's now time to move beyond the so-called 5x5 approach that focuses largely on 5 highly prevalent diseases, and include obesity, steatotic liver disease, CKD, and others. Because if we don't name it, it becomes difficult to act on it. Your Minister of Health from Brazil has been very engaged. We hope that they're speaking with their colleagues across Latin America to rally support for this. I see several colleagues from Italy on the call, and we know that Italy, was a country that led the recognition of obesity as a chronic disease, and that was so important. It was published in the Lancet, and that sets an example for all of us. We were just in Rome last week talking about that and liver disease. Without further ado, let me move over to our third key partner in this consultations. UNITE is the global network of parliamentarians working on global health, founded by the Honorable Ricardo Baptiste Late. And here we have Guilherme Duarte, who's going to speak on, the executive director, who's going to speak on behalf of UNITE, and tell us what this means for parliamentarians at the national level when a decision like this is taken, a resolution is passed at the WHA. Over to you, Guilherme, and thank you for joining us from your travels.
Thank you so much, Professor Jeffrey Lazarus. Hi, everyone, and it's a pleasure for me to be reunited in this important discussion. And thank you for IS Global and all the colleagues for convening this important discussion. So I would like to focus my remarks on the role of parliamentarians, and in particular on the responsibility to bring global health priorities into national, political, legislative, and budgetary contexts. As you know, too often global health discussions remain at a level of technical debate or international commitments. namely in events. But progress does not happen because an issue is recognized globally. Progress happens when the recognition is effectively translated into national priorities, national plans, national budgets, and national accountability. And this is precisely where parliamentarians have a critical role to play. They're not only lawmakers, they can be the political bridge builders between global frameworks and domestic realities. And so they should ensure that emerging health challenges are not treated as isolated technical concerns, but as part of broader national conversation about prevention, equity, sustainability, and health system resilience. A little bit what is being said today here on the advancing priorities of this on the steatotic liver disease. And this is particularly important because we recognize this as not, it's important to be driven by specialists, but it's not simply a specialist issue for pathologists and should be connected to other national priorities that many countries are already grappling with: NCDs, obesity, diabetes, unhealthy diets, alcohol-related harm, access to early diagnosis, and the growing pressure on health systems to manage chronic conditions more effectively. I'm actually present in Washington in spring meetings of the World Bank and IMF, and every week we've been hearing about discussions on financing. How can we finance the overarching pressure of health? And so I believe that in this case, our first task is to help elevate issues like this one on the national agendas. In many countries, these diseases remain, they have long-term burden, but remain under-recognized because they're not politically visible enough. And so we believe that with the help of parliamentarians, we can change this by asking questions, convening hearings, engaging ministries, and speaking publicly. Second, parliamentarians can play a role in integration. One of the great challenges in global health, as you know, is fragmentation. We often create separate conversations for issues. And so at national level, we can help integrate global priorities into these broader frameworks, as previously mentioned. Third, and of course, most importantly, parliamentarians can shape legislation and public policy across sectors. For this, they have to be present into these discussions, including the new resolution, so that they can connect these agendas. Fourthly, parliamentarians are central to budgetary decision-making, public spending, and they can enact or they can promote that the global priorities become national priorities with the following of resources. So, of course, we know that it's not enough to support the policy direction principle, and we must ask whether health systems have the resource, workforce, services, and community-level capacity to respond. Lastly, parliamentarians can create legitimacy and public trust. Health policies are more effective when they are politically understood and socially owned. This is one of the reasons why Unite exists, to actually create bipartisan support. We are a partisan, meaning that we don't want only the government party discussing these matters. We need the full parliament, the full society. And so, of course, parliamentarians, because of their connection to communities and constituencies, they can also bring public concerns into policy making and bring policy discussion closer to the public. So in my view, the broader lesson is this. Global health priorities, like the resolution that we're discussing, only matter if countries can make them actionable. And countries can only make them actionable if political institutions take ownership. And parliamentarians are indeed essential to that process. So thank you very much for including us in this discussion. We will definitely provide our parliamentarians with this information and try to engage them closely to this topic. We know that we have some parliamentarians that are very champion on their own on these liver diseases, and we hope that we can engage more and more. At the end of the day, so I'm ending with this, at the end of the day, global health is not implemented in Geneva or New York or Washington. It's implemented in countries, communities, through national institutions, and parliamentarians are therefore not peripheral to this agenda, and they should be taken also as key actors. Thank you so much, and I hope these discussions are very profitable.
Thank you so much, Guilherme, and I know you have over 500 parliamentarians from all WHO regions in your network, so it's really appreciated that you'll take this forward. I encourage everyone to look at the questions and comments in the chat. We'll see how many of them we can address in the next 6, 7, 8 minutes. But a common theme I'm seeing is what happens after a resolution is passed. People ask about the implementation. What will this mean at the national level? What really changes? So looking towards you, Dr. Gullón, but also to you, Dr. Hassany. If, as we expect, as we hope, there is passage in May, what would happen in Spain and what would happen in Egypt and probably in many other countries when such a resolution is passed?
I will start by myself then. I think that in reality, at the first point, nothing. So that's something that the countries need to have the political purpose of applying this, and that's why it's so important, all the process that Egypt is now doing, trying to get all the people, bringing all together into resolution, because so it's not that the resolution passes, actually, it's all the process of having the resolution and having it passed, the important political steps then to the countries to have this in the political agenda. So in the beginning it's nothing, but I think for us it will put this on the agenda, and as we have a strong focus on obesity in the last years, especially in childhood obesity. But that's something, okay, we need to align this with all the things that we are doing. I said before, the clinical guidelines for steatotic liver diseases to ensure funding, etc. So it's not something, the approval of this makes a movement in all the countries. No, all the process that actually Egypt is doing with other countries is the thing that will move the countries to do things.
Great. Do you have anything to add, Dr. Hassany?
Yes, Professor Lazarus, I'm echoing Dr. Pedro on that. It's not a magic stick, but I'm trying to be very pragmatic. If I would say that we have some immediate actions to be taken after the adoption of the resolution, including the official notification to the member states that we have now an adopted resolution, and then going to the integration of the steatotic liver disease into the work plan of the WHO NCD department and the global action plan for the NCDs till 2030. This is one of the fundamental issues that we are seeking to, or asking WHO to do as fast as we can. One important thing is the mapping of the existing WHO guidance relevant to steatotic liver disease, like the one on obesity, alcohol, primary care, diagnostics, everything that may, improve the context of the diagnosis, prevention, management of steatotic liver disease. And last but not least, in the immediate action is the initial briefing to the member states at the WHO regional committee meetings, like the Euro, the BAHO, the EMRO, on available technical support for the countries that can be offered from the WHO HQ to the countries. This is one of the, if I would say that this is the immediate actions to be taken after the adoptions. If we're looking forward to more medium-term actions, perhaps if I say it may take maybe 1 to 2 years post-adoption, the development of the technical guidance, like the toolkit for the member states on integrating the steatotic liver disease into the primary care and NCD strategies, and also incorporating the steatotic liver disease indicator into the existing WHO monitoring frameworks. And we fighted a lot for this while the process of consultations had happened, in order to have, the expert consultations, to have the biennial reporting framework from the Director General to the World Health Assembly on the progress in addressing steatotic liver disease as a fundamental part of the global NCD agenda. This is from my perspective, and definitely this will add to what's mentioned by Dr. Pedro. This is from the global perspective and WHO perspective, and also the same thing as mentioned by Dr. Pedro, that we need the political will, the cascading down of the paras inside that resolution into the operationalization in every member state. Thank you very much.
Thank you. And I think you've answered a lot of questions that I'm reading here. So, Kush was commenting that when WHO spoke at the EASL Congress, that's the European Association for the Study of the Liver, that will also be here in Barcelona next month. They were saying, well, we included along with the other NCDs, and we also heard at the World Health Summit last year that maybe we don't need a specific resolution. But again, the societies came together, including IDF, WAF, but also all the liver societies, saying we really need to name it and act it, and name it as a disease that needs action. But you've also explained, Dr. Gullón, Dr. Hassany, that it's not a magic bullet, and then the next day everyone says, let's put our funding in and address steatotic liver disease. What it really does is it empowers WHO, as you mentioned, to develop toolkits to address this in their 6 regional offices and at their headquarters. But it also empowers all of the advocates So it's true that I think everyone on this call is a strong supporter of the SLD resolution. But what you need to be aware of is then your work changes, but it continues. Now you're not advocating for the resolution, you're advocating and you have a resolution behind you to support your work in countries. And just like with other diseases, other conditions, we'll see this go faster or slower depending on the national context and the priorities they have there. I see Dr. Sahar Saeed in Canada wrote asking about harmonizing data and outcome definitions. This is why we need a strong WHO. We need this harmonized at the global level so we're all reporting in a similar fashion. We can compare across countries and learn from each other's experiences. I'm going to start to wrap up, but I don't know, Bruno or Guilherme, if you have a last brief comment or reflection. Otherwise, I'll move to the closing.
No, I totally agree. I think that what someone said here, that with the resolution approved, no one can ignore it's more the importance of steatotic liver disease for the society, and I think it will be a step forward in this.
Thank you.
And we are together, and I think we can do a lot of things together on the obesity and the liver disease field.
Well, I hope during the opening of ICO, you'll be able to say that the resolution has passed and the collaboration has been successful. Guilherme, last comment?
Yeah. Yes, absolutely. I would also join all the voices and say that this is an important with all the actors to make sure that that things are keep moving. Thank you.
Then, thank you, Guilherme. Let me move into our closing. So I'd really like to thank again there's a little lag time with the slides, apologies, but thank all of you for joining, but particularly the partners from the Global Think Tank on Steatotic Liver Disease, the International Diabetes Federation, Unite, and the World Obesity Federation. This is a good test of how well I remember my slides when the title is covered up. But this is a roadmap that will be launched on the 26th of May during the Global Think Tank meeting and the day before the EASL Congress. It's what the road to success in steatotic liver disease policy looks like over the next 5 years. We're launching the EASL Lancet series on chronic liver disease. There's an EASL Lancet commission that will be coming out. So the evidence, the publications, the thought leadership is there. The WHO Executive Board, as you can see on the right, unanimously approved the resolution to go to the World Health Assembly, and we hope and think that this will get approved in May, making this really the landmark year for steatotic liver disease, just 3 years after we developed the new definition, the new nomenclature. Dr. Peter Schwartz mentioned the UN General Assembly high-level meeting in 2027 on universal health coverage. It's important to remember that right now in the UHC discussions, steatotic liver disease is not mentioned at all. So it's incredibly important. We closed the door on SLD resolution, but we open it on UHC and we need to make sure that universal health coverage is also including all aspects from prevention, which it probably will, but also the diagnostics and treatment of all aspects of steatotic liver disease. And we chose 2030 because we're thinking of the framework of the Sustainable Development Goals. We're neither using the previous nomenclature or the current nomenclature. Steatotic liver disease is included. So we need this kind of global unity that will really come together with a WHO resolution as we work towards universal health coverage for all countries that includes steatotic liver disease, and as we work towards national adoption, which will be a long and challenging process, and as we work towards achieving the SDGs and thinking about the post-SDG era. So with that, thank you again to all our speakers, Dr. Hassany, Dr. Gullón, Dr. Halpern, Dr. Schwartz, Guillermo Duarte. Thank you everyone for joining us, and thank you to the team here at IS Global for putting together the consultation and running everything so smoothly. We'll be back again in 2 days for those of you who didn't get enough. There'll be some of the same talks, also some new perspectives, but we look forward to moving the field ahead together with you.